All right, thanks for giving us a few extra minutes for the media briefing today. We're ready to get started. Thanks for joining us on this Monday. We're going to get started with Dr. Moreno, who has an update on a variety of issues for us today. Hi, Dr. Moreno.
Hey, Maya. Good morning. Good afternoon.
Good afternoon.
Hi. So, good afternoon, everybody. So, I guess the principal update I want to provide is on the data reporting within our state data reporting system. So, I believe we did mention the last Friday that we had we had noticed what appeared to be a decrease in number of cases or case rate over a period of time. And other counties were seeing something similar, and the state looked into it and did identify some issues. And those were explained to us, Dr. Galley, publicly, and California public health leaders presented the issue and the resolutions that they've decided on to address the issue Friday afternoon. So since then, we have late Friday, we started seeing some of those previously unreported cases show up in CalReady on our end of the data system. And we started entering those into our local roster and began assigning those cases to case investigators. Over the weekend, we continue to receive a large amount of backlogged cases. These are both positive and COVID tested, negative COVID tests. The majority of course, are negative tests. So as far as the backlog, I believe the state was estimating somewhere between 200 and 300,000 lab reports that needed to be pushed through that hadn't been pushed through because of the issues that the state described last week. Looking at how many we've received certain times of backlog, we're looking at about 1,000 or at least 1,700 total tests that have come in over the weekend that previously hadn't been reported to us. So that's just the backlog. That doesn't include the new cases that continue to come in every day. So we do have quite a few to go through. Most of those are going to be negative tests, of course, but some of them will be positive. So as we identify all the positives and move those positives into create new incidences, we will do what we can to get to make contact with those individuals to find out how they're doing and follow up with the making sure that if anyone still needs to be in isolation, they understand what the isolation requires and for how long. And but at least we can also talk to them, find out who they have been in contact with since they had their symptoms, and we can still work with them to notify close contacts that may still need to be in quarantine. So we worked hard this weekend to try to get as many of those over to ready to be assigned to case investigators who are going to make contact with these individuals. So the state is thinking that the state believes that they were able to get all the reports to us, and now each of the counties are looking at the backlog that's coming in to see if there's if it looks consistent with as the backlog cases are added to our local data, to make sure that the trends are corrected and the case rates are more consistent with what we think we're experiencing here at the local level. And then we'll continue to give feedback to the state as to whether we believe the backlog issue has been completely resolved. For now, the state is still requiring that laboratories fax the positive test results to local jurisdictions, just to make sure that the results, one way or the other, are getting to public health officials throughout California. So I think that's where we're at with regards to the data issue that the state is, issue we've had and where we're at in resolving it. Other than that, do you want me to take questions now, or do you want me to move on to schools?
Why don't we go on to the schools and the youth sports topic?
Okay. All right, so the state has issued guidance for youth sports, and much of it is what we anticipated it being, and that is guidance for that would allow for children to gather, to have organized physical activity, and that the guidance is applied to any youth sports that are sponsored by schools and those that are not sponsored by schools. Generally, in general, I think the highlights of the youth sports guidance is that the groups or the organizers are encouraged to have groups as small as possible. The state pointing out that there's less transmission that could occur in smaller groups compared to larger groups. The other important feature here is that the participants need to conduct their activities outdoors and have to keep 6 feet apart from one another. There's also a requirement that the participants not share any equipment. And so that would mean that they have to bring their own equipment, and then not sharing really means that if someone forgets some equipment at home, one child shouldn't lend the other child their equipment, and that they shouldn't be kicking or tossing balls back and forth between each other. So most of the activities that are allowed would be therefore just single individual exercise and fitness and training with, for example, with a soccer ball, but each child would have their own soccer ball or their own basketball, and not be tossing or kicking those back and forth between the kids. So that's the guidance that's out, and so organizations have there are still some options for getting kids physically active. We do still have the camp guidance that's out there, and now we have the youth sport guidance. There is, or we do anticipate that the state will issue guidance for the for adult sports. I don't know. I don't have really any details on that, Maya, or what that would look like, or when we can expect that to come out.
Thank you for that. And you mentioned school update. Is there any information you want to share on that right now?
Only that, thank you, Maya. Only that I have met with the school superintendents, and I did issue a letter to Superintendent Gus and the superintendents, just reiterating what the state has already shared statewide, and that is Monterey County schools, or schools in Monterey County, will have to start the school year with distance learning. That is because we're on the monitoring list, and so that hasn't changed. And I also reiterated that, particularly for Monterey County, since we have our case rate exceeds 200, that the state is not recommending that any schools start in classroom instruction, even with a waiver request. And so I did let the superintendents know that I think they should consider working on plans which would prepare them to submit an application for a waiver request, even though they're not going to be approved at this time. And the main reason there is so that the schools have thought in advance what type of resources and reallocation of resources or reassigning of staff and training of staff would be required to meet all the requirements for in classroom instruction. That also includes conversations with the parent groups and staff groups and the community, which is a requirement requirement of the superintendent if he or she is to submit a waiver request. So that's I think the update on schools.
All right, thank you for that. And then we'll take questions on those issues after our next presenter. And we're pleased to have Nick Pasculi with TMD Creative joining us on the briefing today. Nick has played a very important role in amplifying the county's important health messages out into the community. And he's going to share some information on that with us this afternoon. Hi, Nick.
Hi, how are you today?
Good, and you?
Good, thank you. So we have been working with the county to get some messaging out both in English and Spanish. We've covered a tremendous amount of ground since we started on June 1st. We've created alliances and partnerships with all the local media, including PSA schedule as well as a paid schedule. And some of those assets that are currently deployed include billboards. There are currently 8 billboards throughout the county. 5 in the Salinas Valley and 3 in the city of Salinas. And I'm sorry, one of the 5 is also in Seaside. We're also doing buses through MST. So we do have the sides of buses. We have about 15 buses that have messaging on them in English and Spanish. In addition, we had a public service announcement campaign on radio and television, working in partnership with local media and print as well. So we're trying to cover all bases and not just trying to reach our citizenry, but also trying to reach the thousands and thousands of visitors who come to our beautiful county every week. So it's a multi-pronged approach. In addition, we've partnered with other business groups, business associations, industry-specific associations to help get the messaging out and to make everything that's being produced by the county available to all those organizations. And so such as chambers of commerce, business councils, ag trade associations, and hospitality associations. We have also been very, very fortunate with getting some celebrity star power to help us get the messaging out, and particular on Spanglish language television. Spot with featuring celebrity Don Cheto will be airing in the next couple of weeks, a public service announcement by him, and another one by Piolín, who's a famous radio star and the first Mexican star to be in the Radio Hall of Fame. Is producing 2 spots, has produced 2 public service announcements for us, which are airing as well. So again, we've kind of take this multi-prong approach, working in partnership with local media as well as business associations. On the school front, because we all know that school's getting ready to start, we've been partnering with the Monterey County Office of Education to get materials in the hands of parents. So approximately 80,000 family smart guides will be distributed through the Monterey County Office of Education that will help families with educating and children with regard to COVID, as well as some very good tips regarding what to do in the home and out of the home. Additionally, we're working on a multi-family guide that is for households where there are multiple families involved, or multi-generational families, or congregate housing. And that is in the process of final review by the county, and we should be able to distribute that sometime next week. One of the big concerns we have coming up, which is continue to be a concern, is the large gatherings. As you're probably aware, the people are not necessarily adhering to the warning against large gatherings, and so we're working on a public outreach campaign discouraging large gatherings throughout the county. Maya, did you have any other specific oh, I beg your pardon, I forgot to mention the digital campaign. We did a digital campaign primarily targeting the Spanish-speaking population, which has been wildly successful. And the performance of people actually clicking on the links that we've been pushing out, the last report we got was close to 22 times the national average. So it makes us feel good that people are accessing the information that the county is putting out to help educate themselves and their loved ones about the importance of staying safe and how to protect themselves during this pandemic. Maya, was there anything else you'd like me to mention?
Gosh, I think you hit everything. Thanks very much. Very thorough overview of the work that's being done. Now is the time that we're going to go ahead and take questions. So Nick, if you would stay on the call in case we've got some questions for you. The first few questions I have for Dr. Moreno, and so we'll get started with those. Dr. Moreno, the American Academy of Pediatrics reports an increase in children and youth testing positive for COVID-19 in the past 2 weeks. Are we seeing a similar trend locally?
Thanks, Mia. So I haven't read any that from the American Academy of Pediatrics, but we do have increased numbers in youth being both tested and testing positive. I think part of it, in talking to some of the primary care providers, is that as the local clinics, primary care clinics, have increased the availability of testing at their locations, the families or parents are bringing in children for testing. A common, not common, but one example is drive-through clinics where they have several people in the car. Providers might be more inclined to go ahead and just test the youth that made the trip. And so, but I don't, maybe someone could share that, someone could share that reference to AAP with you, and I can look it up. Thanks.
All right, thank you. And another question for you, and this is regards to team sports. The guidance that you were talking about, does that apply to team practices only?
It applies to both teams and non-teams. So, but it was, I think it came out from a lot of interest in California for teams to begin to practice. And this is a way that they can practice certain drills or skills and get youth back into training for physical fitness and to some degree some strength building. Teams and non-teams can benefit from this. I'd also point out that the guidance does allow for training and fitness indoors, but only in counties where gyms are allowed to operate indoor activities, and we're not, Monterey County, in Monterey County, gyms are not allowed to have indoor activities, so youth sports cannot participants in youth sport activities under this guidance can't do so indoors, and they need to conduct their practices outdoors.
I think, Dr. Moreno, I'm going to take this follow-up question just out of order since we're on this topic. So team competitive play is still not allowed?
Correct. So that is, yeah, because under the current guidance, even if a team got together, they still have to, they can't share equipment and they have to stay 6 feet apart from each other. So yeah, so at this point, there's no competitive games allowed.
All right, thank you. And another question for you, is the state backlog in data the reason the Monterey County data dashboard is currently showing zero change across the board for all the topics and categories? Are we working on that?
Oh, yes. Yeah. So there's two. Yeah, thanks for the question. So just an hour or two ago, I looked on the state website. They haven't populated the data monitoring list because of the backlog issue. So the state is not putting it up there. We are continue to update our metrics, and we have been doing that, even though there's we have a disclaimer now on there that because of the state issue, the information that we're putting up may not would most likely underrepresent the total number of cases within Monterey County. As far as the zeros that are on our website, that is because our epidemiologists are still addressing some data system issues, and we're hoping that we will get it out there hopefully by mid-afternoon, and we'll have an updated website.
Thank you very much, Dr. Moreno. And another question for you, just to confirm what you said about the waiver request for schools. Did you say because Monterey County's case rate is above 200, waivers will not currently be approved in the county?
That's correct.
All right. And now a question for Nick Pasculi. Are we doing any messaging in languages beyond English and Spanish, such as Mixteco?
Presently, we are looking into other opportunities with regard to language, but presently we're doing Spanish and English.
Thank you for that. And then back to you, Dr. Moreno. Monterey County had its highest day of hospitalizations over the weekend. What do you attribute this surge to, and how full are our hospitals? And do we have any information on the demographics of those who are being hospitalized? I can break this question out for you if you need to.
Well, go ahead.
So let's start with the highest day of hospitalizations over the weekend. Any thoughts on what this is attributed to the surge?
Yeah, so we do see hospital census go up and down, but overall, what I think we're seeing is a general trend up. And in our meetings with hospitals, they are describing the increased activity in their hospitals, and that's really all I can probably say about that, since I don't represent the hospitals, and they're the best source of what's happening. In terms of why it's happening, it's been the number of COVID hospitalizations has slowly been going up, and I think as that's the hospitalization itself is one indicator of morbidity, and as long as the case rate continues to go up, which I think is a good chance once we get all this data backlog input, we may continue to see a partial, hopefully complete correction of the data. We'll still have, I think, a trend of increasing case rate. The morbidity will continue to increase as well, which again is hospitalization is one indicator of morbidity. So I think that's probably a partial explanation. But again, I think it'd be I think important for if the media wants to pursue this further, to get in contact with the hospitals and find out what is actually happening in their facilities.
And that would follow up to the question about demographics of those being hospitals. The best source of that would be our local hospitals, correct?
Well, let's see, 1 second here. So on our website, we still are posting the demographics of both hospitalized patients and the fatalities. And again, as there are more cases that are hospitalized and more fatalities, we'll be able to continue to break this down further. But Yeah, at the very bottom of our website, our data website, excuse me one second. Okay, I just got notified that our monitoring metrics on our website has just been refreshed. So you guys can go take a look at that if you like. But the demographics are on that bottom of the page, and we've broken it down by race, ethnicity for hospitalized patients, and also so it's a number and also proportion of hospitalized cases. And then and as far as fatalities, as much as we can break it down right now, we've also done that as well. And we also have done it by age groups, and those are the same age groups we're using for the other data tables. And we have the number of hospitalized in each age group, and also their proportion of all the hospitalized cases.
Thank you, and thanks for updating the PIO on what's on that page as well at the very bottom. Another question for you, Dr. Moreno. Do the youth sports guidelines apply only to organized youth sports, or are they applicable to all forms of recreation, including adults, such as adult leagues or informal athletics?
So there's requirements in here which need to be met by anyone who's bringing the kids together, which means it needs to be organized. And so this is going to be most easily achieved by anyone that's involved with organized sports. And that's primarily what it was intended for. Where the state, I believe, is trying to issue guidance that can be implemented in an organized and responsible manner. And if someone is thinking that they'll bring a bunch of kids together to a park and just bring them together and not have an organized agenda and a schedule and a routine, that wouldn't be consistent with this intent. That would be more of just a group gathering, which still aren't state's not permitting. So someone really has to think seriously about if they're going to do this, that they have identified a significant benefit to bringing the kids together, and also that they can strictly follow all the guidance. So I hope that helps.
I think this question was asking whether the youth sports guidance could apply in some way to adults who
Oh, that's the other
play
part of it. Yeah.
adult leagues. Would these adult leagues be considered a gathering, as you were describing, bringing the kids together?
No, this is just for youth. There's separate guidance that's going to come out for adults. But I don't know when that's going to be. But this is just for the kids.
All right. Thank you very much, and thanks for clarifying. That's all the questions that I have in chat for our presenters right now. Are there any other questions for anyone on the briefing today?
Maya, this is Sara Rubin. If I may, I tried raising my hand. I never know if that really works.
Please, go ahead.
I wonder, Dr. Moreno, on the data, when it is fixed from the state, will we expect to see it reflected as one big spike today, or will there be some way to reconstruct it? Will the trend line reflect what the data reflects, or is it just based on when it populates in your system?
Yes, sir. So when we get what we report on a daily basis is the number of cases that we're able to confirm and enter into our local side of CalReady. But when you look at the epi curves, we have an epi curve that's based on date of onset of symptoms, I believe. And so there may be, if we work really hard, we'll have quite a few cases to report over the next probably 2 or 3 days, if we can get caught up quickly. But then the epi curve will hopefully maintain again a steady increase that we're seeing right now, because those will be reassigned to the date that the patient had their onset of symptoms.
Sarah, I was going to say, if you have a follow-up, go ahead.
I do have a follow-up, which I guess is, as far as what you might expect, it sounds like you expect to see something in the data that's different than all these zeros we're seeing. I wonder, what you're looking for, and I guess big picture and a takeaway for our readers who are not, data nerds, is might the data backlog affect anything? Are we likely to see a change to reopening of schools or restaurants or some other thing?
Mhm.
And how does the data itself and the backlog affect that kind of decision making?
Okay, thank you. So from what I understand, the state has focused on bringing what they believe to be the backlog from July 27th through August 7th. And so again, if we can get those in, hopefully the next few days and assigned out, then we'll probably see high reports. But then our staff will talk to the individual and find out when they really had symptoms, and they will be reassigned to a different date. And so the curve is going to, first of all, that'll affect the curve. But what I think what's going to happen is that what may happen is that our 14-day case rate is going to go up, partly because the dates between July 27th and August 7th, excuse me, many of those days still lie within our last 14 days. So our most recent case rate will probably go up. And the impact of that on decision making will be probably not, I don't think anything urgently, because we've already exceeded we're already in the monitoring list, and we've already exceeded the 200 per 100,000. And so there is no further restrictions that I know of that the state has implemented on counties that have higher case rates than we currently have.
Sarah, does that answer all of your questions while you're on?
Thank you. Yes, I did have some questions for Nick too about the PSA campaign, but I don't know if that's off topic for you right now.
No, it's not off topic. He's still on the line. Go for it.
Hi, Nick.
Hi, Sarah.
I wonder, I'm a little confused, and it might be my notes, but the numbers, it sounds like you have 8 billboards, but my numbers don't add up. 5 in the Salinas Valley plus 3 in Salinas and 1 in Seaside gives me 9.
Yeah, that's my mistake. There's 9.
Okay. And then do you have an exact number for buses? I have about 15. I wonder
No,
if,
there are 15 buses as you know, the MST routes are random, so they get distributed all over the county on a daily basis.
thank you. And then the contract itself with TMD for the outreach, can you tell us how much that contract is for, and a little bit more about the scope of work and over what kind of time period we're looking at?
The contract that we have, the consulting contract we have with the county, is through the end of this year, so December 31st, 2020. Nick Chiulos, who's on the call as well, is the administrator in charge of the contract with us, and that's who we report to. And it mostly, as far as the cost is concerned, the hard costs are separate. So anything that the county pays for placement is separate from the contract that we have with the county.
And Maya, let me just answer, and Sarah, this is Nick Chiulos. So we have the TMD contract is a 6-month contract with the possibility for a 6-month renewal. It's a $10,000 a month retainer, and then the hard costs are billed at whatever the cost is, And we initially, the contract is structured as a COVID pandemic emergency response messaging campaign to try to give us the best opportunity we have to get FEMA reimbursement for that. But we are also potentially using CARES Act funding that the Board of Supervisors is going to receive a proposal from the staff on how the CARES Act funding might be allocated on August 18th. And so it's possible that we may use some CARES Act funding for that as well, or in addition to. So just to kind of give you that a little more information.
Thank you. That is very helpful. in a few
Okay,
ways.
you're welcome.
I appreciate
Sure.
that.
You bet.
And then my other question, I guess, is, how do we measure effectiveness of a public outreach campaign like this? Can you detect it, I guess, beyond the number of clicks that we get, but are there health metrics of, an infection rate, or if you see a community's infection rate drop off, are there other data points that we might turn to monitor that?
Well, Nick Pasculi, you might want to speak to the way you are monitoring some of the effectiveness of the campaign.
Yeah, so we're looking at analytics almost on a daily basis, Sarah. So we're looking at website stats, we're looking at social media stats and whatnot. And we're getting a tremendous, we did have a digital campaign as well, separate and apart from, what would be organic, if you will, from a social media and web standpoint. So we are monitoring those numbers very, very closely and using a third-party monitoring for that. As far as things like radio and television, public service announcements, as you well know, and including print media, which we are using, including the weekly, it's anecdotal. So we look at the audit reports and the ratings for each station. We analyze the biggest, the biggest audience we can capture in specific time slots or specific day parts, if you will. When we're talking about broadcast media, we're talking about print media. Obviously, we're looking to target a broader base. Obviously, combination of all the various mediums gets a very high penetration rate in the marketplace. So compiling the data from Nielsen and other third-party audits, we have a fairly high confidence level that we're reaching a very, very high percentage of the population in Monterey County, as well as those people coming to visit, which was one of the other strategies in the placement of the billboards, is to get the visitors as well as the local residents.
All right. Any other questions from the group? Hearing no one, seeing no questions. Thanks everyone for joining us on the briefing today. Our next briefing is Friday, and we'll see you then.